Secretary of Health and Human Services, Robert F. Kennedy Jr., says autism is an epidemic that's being driven by environmental toxins. And he's promised to study the causes with results forecast for September.
And joining us in studio now is board-certified psychiatrist and assistant professor at Columbia University, Dr. Mina Merhome. Dr. Merhome, thanks for coming with us.
Thanks for having me.
Yeah, great to have you in this morning. RFK Jr. has said autism destroys families. It's an individual tragedy. Let's lay out the scope. I mean, what really is autism?
Yeah, great question. And I think the comments from RFK Jr. were reflecting more of folks who are really struggling on the lower end of the spectrum. Whenever we talk about autism, we're talking about a spectrum of disorders. You can have folks who are struggling with communication, verbal skills, social skills in this large area, all the way from being nonverbal and needing 24-hour support, all the way to a higher functioning where you can have really fulfilling, independent lives. So that's kind of the difference that we see. But nonetheless, it has been a difficult, challenging thing for families to deal with as well.
Yeah, and I've been reading on this. According to the University of Rochester Medical Center, you really do have to be patient. A family has to be patient when handling someone who does have that diagnosis. And now, further, when we look ahead, we talk about the hope. Is there hope for this? I mean, because there are a lot of research studies being done right now.
There certainly is, and especially now, I think this is a moment where there is this magnifying glass that's being put onto this diagnosis for the 5.4 million people living with it in America. That's being more humanized. April is actually Autism Acceptance Month. There's more research coming in to say, well, we know there is a genetic component. We know there are environmental components. We know there are some things that are modifiable that we can look at. And the more we can study this, the more effectively we can find therapies that are effective. Although we have some things now that with early intervention go a long way for folks with autism.
And I do want to get into that, but taking a step back, there may be folks out there who are wondering, does my child potentially have autism? What are some of the signs, early warning signs to watch out for?
Early warning signs are key. This is one of the most important things when it comes to autism is we can reliably diagnose it by about age 2. There are tools that we use, a checklist where we look at verbal communication, social interaction, if there's a delay in speech. These are all things that we're looking at in the first 1 to 2 years of life. And the earlier we can have this intervention made, the more we can implement those early therapies, speech therapy, ABA therapy, that can help the child develop. But if I'm seeing a child who is startled by slight noises, who has a hyperfixation on some routines, has difficulty interacting with others, difficulty with eye contact, these are all signs that I want to be aware of in a young child.
And Harvard studies show that back in 2000, there were only maybe 6 or 7 people out of 1,000 with ASD, but now that's jumped up to over 16 per 1,000 in 2014. So, I mean, you're free to comment on that, or just tell us what are the most important steps after receiving that diagnosis for the family.
Yeah, absolutely. There's been a lot of discussion over the past couple of weeks as why are we seeing 1 in 36 children now with this diagnosis? Why are we seeing such an uptick over the past couple of decades? And there are a couple of reasons for that. One, in my lifetime, over my training, diagnostic procedures have gotten much better. Awareness. There wasn't a time maybe a decade ago where I'd be in a channel discussing autism awareness. So our screening, our focus on early diagnosis, detection, and the resources that go into that also have come a long way. And that's part of the reason why we've been able to make more of these diagnoses early, where at times we could have just missed this person. This is somebody maybe when I was in class with a young person, they could have been just thought of as, oh, this is a quiet person or someone more disruptive. We would have missed those diagnoses.
And there's been progress on screening and diagnosis, but there's also been progress and developments in terms of treatments. What are you seeing there?
Yeah, absolutely. So treatment, just like the disorder itself is multifactorial with where it comes from, treatment also is multifactorial, and the combination between therapy and medications. The gold standard therapy is called ABA, or Applied Behavioral Analysis, and that works on communication skills, verbal communication, social interaction, and there are some medications as well that can be used whenever there is out of control aggression in a young person. Medications like risperidone and Abilify, we can use those to effectively help the person cope better.
Yes, and Dr. Merhome, I think it's really important to point out that some people with autism, they want more affection. Yes. Some are, you have to be careful. You shouldn't do that because they might react a certain way. So how do you cater your approach?
That's exactly key, Kevin. The idea here is this is individualized, right? The individual approach to a person with autism, it's not a one-size-fits-all. For some folks, they like a particular kind of affection, just like you and I, right? We have a particular love language, if you will. So a person with autism, they may be able to tolerate this level of stimuli, whether it's verbal, or the environment and otherwise, we want to be able to tailor that, give them the proper level of support that's appropriate for them. And as we make an individualized plan, they're much more likely to thrive that way.
Well, with such a prevalence now, and it seems to be increasing, of this particular condition, it's really important to come in and spread awareness about this, especially for Autism Acceptance Month. Thank you so much for coming in, Dr. Mina Merhome. Always great to have you with us.
Thank you for having me. Appreciate it.